Hey everyone, today let's talk about something that affects millions of people, a lot of times without a single symptom, and that's fatty liver disease. Now I know, it sounds pretty serious, and it definitely can be, but here's the really good news. For a lot of people, the power to turn it around is literally in your hands. So let's break down exactly how.
Does this sound at all familiar to you? You go in for some kind of routine scan, maybe for something totally unrelated, and the doctor just casually mentions, oh, by the way, you have a fatty liver. It can leave you feeling kind of confused, maybe a little worried. So what on earth does that actually mean for your health? So here's our game plan for this explainer. First, we'll get into what fatty liver disease actually is. Then we'll look at how it can progress. After that, how doctors even find it in the first place. Then we're going to get to the most important part, how your lifestyle is pretty much the cure. And we'll wrap it all up by busting some really common myths. Okay, so let's start right at the beginning. When a doctor says fatty liver, what is actually happening inside your body? What does that even mean? Well, honestly, it's pretty much what it sounds like. The official diagnosis comes when more than 5 to 10% of your liver's total weight is made up of fat. You might hear doctors call it NAFLD or the newer term MASLD. A good way to think about it is like your liver's delicate machinery is getting clogged up with all this extra fat, and that starts to slow down all the important jobs it's supposed to be doing. Now, it is really, really crucial to know that there are two main types. The first one, and the one that's becoming way more common, is non-alcoholic fatty liver disease, or NAFLD. This one isn't caused by drinking too much alcohol. Instead, it's really closely tied to things like obesity, diabetes, and high cholesterol. The second type is exactly what it sounds like. It's caused by heavy, regular alcohol use. For the rest of this explainer, we're really going to be zeroing in on that non-alcoholic type. Okay, so you have some fat in your liver. Big deal, right? Well, what happens next? It's really important to understand that this condition can move through different stages, but the good news is, it's a journey where you can almost always hit the brakes.
So it all starts with what's called steatosis. This is just a simple buildup of fat, and that's it. For a lot of people, it never goes any further than this. But if inflammation shows up to the party, it becomes stage 2, which is known as NASH. That's when you have fat plus inflammation and some liver cell damage. If that inflammation sticks around, it can lead to fibrosis, which is basically scarring. And the final, most serious stage is cirrhosis, where that scarring becomes severe and can permanently damage the liver.
Now, wait a minute. Before that last slide gets you worried, I want you to really focus on this. This is probably the most important thing to take away from that whole section. The truth is, with early management, most people who have a fatty liver will never progress to those more serious stages. The key word there is managed. So, if this is a silent condition with no real symptoms, how in the world do doctors even find it? Let's take a quick look at the tools they have. A lot of the time, the very first clue is just a routine blood test that shows slightly elevated liver enzymes. But honestly, the most common way it's discovered is through an ultrasound, which lets doctors literally see the fat on the liver. To check for any scarring, they might use a special kind of ultrasound called a fibroscan. It's only in pretty rare cases that a liver biopsy is needed to really get the full picture. And here is a super, super important point. You can have a completely normal liver function test and still have a fatty liver. Seriously, those blood tests don't always tell the whole story, which is why imaging, like an ultrasound, is so incredibly important for a diagnosis. You just can't assume that no news is good news based on blood work alone.
All right, so we've talked a lot about the problem. Now, let's get to the best part, the solution. And this is where you, personally, have a ton of power. Because the real treatment for fatty liver, well, it isn't found in a pharmacy. It's found in the choices you make every single day.
Let's be absolutely crystal clear about this. Right now, there is no magic pill, there's no special medicine that can just melt away the fat in your liver. The scientifically proven, evidence-based foundation of treatment is all about one thing: lifestyle modification. And you know what? That's both the challenge and the amazing opportunity.
So, what's the actual goal here? The magic number is right here. Study after study shows that losing just 7 to 10% of your body weight can have a massive impact. It can dramatically reduce liver fat, bring down inflammation, and in some cases, even reduce fibrosis. Think about it. For someone who weighs 200 pounds, that's just 14 to 20 pounds. That's a totally achievable goal that can literally transform your liver's health.
So what does this actually look like on your plate? Well, forget about crazy crash diets. The goal is to move towards more of a Mediterranean style of eating. That really just means focusing on balanced meals that are packed with high-fiber foods, like lots of green vegetables and whole grains, and of course, lean protein. It's all about nourishing your body, not depriving it. And what you don't eat is just as important. The biggest culprits that really help pack fat onto the liver are things like fried and oily foods, tons of sugar and desserts, soft drinks and sodas, and all that highly processed junk food. Cutting way back on these is one of the most direct ways you can give your liver a much-needed break. Now, diet is one half of the equation, right? Exercise is the other. The goal to shoot for is at least 150 minutes of moderate activity every week. And this doesn't mean you have to go out and become a marathon runner tomorrow. We're talking about things like a brisk walk, a bike ride, or going for a swim, basically anything that gets your heart rate up a bit. All right, finally, let's clear the air a little bit. There is so much misinformation out there about fatty liver disease, so let's just tackle a few of the biggest myths head on. Okay. The biggest myth, and the one that causes the most fear for sure, is that getting a fatty liver diagnosis is basically a one-way ticket to liver failure. The fact is, that is absolutely not true. Most people, especially when they take control of their lifestyle, will never progress to any serious disease. It is not an automatic sentence. And what about all those liver detox teas and juices you see all over the internet? The myth is that you can just drink some special concoction or take a supplement to clean out your liver. Here's the hard fact. There is zero scientific evidence that any of them work. Your liver is its own detox system. The absolute best way you can help it do its job is with a healthy diet, exercise, and weight management. Simple as that. So let's just bring this all home. Here are the most crucial points to remember. Number 1, fatty liver is incredibly common, but it's also often reversible. 2, changing your lifestyle is the single most powerful tool you have to treat it. 3, not everyone goes on to develop serious liver disease. And finally, working with your doctor and getting regular checkups is absolutely key to managing this well. When you boil it all down, the message is actually pretty simple. A healthy lifestyle today protects your liver tomorrow. It's not about finding some quick fix. It's about making a real investment in your long-term health. The choices you make every single day, those are what really, truly count. So think about it. What's just one small positive change you can start with today?